9:56 exactly. On to our last interview for the morning. And globally, around 38 million people are living with HIV. And since the detection of the virus in 1984, around 35 million people have died of HIV or AIDS-related illness. To talk to us about World AIDS Day is Sibongile Tshabalala. She is the Treatment Action Campaign National Chairperson, and we're going to be looking at the theme of this year's World AIDS Day and how it can make a difference in the lives of people suffering from HIV and AIDS and their loved ones. Good morning, Sibongile. Welcome to the program.
Good morning, and thank you for having me on your program.
Pleasure entirely. We need to raise awareness. And would you say that we are winning the fight against HIV and AIDS, or do you think that COVID has kind of put this whole issue under the radar?
Actually, as much as we have made so many strides to fight HIV, and we had so many breakthroughs, but COVID, it came and it overtook all the attention from the HIV and to COVID, which it also took us a bit back as HIV program for the HIV program, because we've seen less of testing, people testing for HIV, people initiated on HIV, and also people living with HIV had so many challenges in terms of accessing services on the ground. So yes, COVID has overtook the focus from HIV, and it has a bit of took a step back for HIV to focus on it and the services of HIV.
Okay, do you think that this year's theme is going to address that problem, to bring HIV back into the front line where people are reminded once again that they need to be alert, they need to be aware, and they need to get the necessary treatment should they test positive for HIV?
Yes, I think the theme is okay. What is important is the implementation on the ground. You know, because we've been having all these things that are sending the right messages. But then when people are supposed to access services, then it's another problem. So the theme and the implementation needs to go together. As we are saying, we want to HIV and also make sure that people are adhering to their treatment. Also, the services on the ground needs to be in place for the people to be able to access them, because talking is very cheap. We need implementation. Implementation can help us to fight the fight against HIV.
What happened during the lockdown? Were people able to access their AIDS medication, their antiretrovirals? How did they manage to access it?
There were many challenges during the hard lockdown. Remember, in South Africa, we have people who are coming from rural areas or other provinces and coming to big cities for work. And during when President announced the lockdown last year, everyone was scared and everyone didn't know what is happening. And everyone wanted to be with their family for that 2 weeks, the first 2 weeks. And people went to other provinces, of which the lockdown took longer than that 2 weeks that we expected. So people were locked down in other provinces and they were unable to access treatment because they didn't have referrals for them to be able to access treatment in those provinces. But also the issue of healthcare workers being infected with COVID-19. In most cases, clinics were closed without any communication, and patients were left stranded without any communications to say where can they receive their treatment. And also in other cases, when the person didn't come on the day, on the appointment date, the person will be put back on the queue, and without even listening to the reasons why the person missed the appointment date. So that made people not to take their treatment, and it has affected mostly the services of HIV.
Finally, Sibongile, God forbid we don't undergo another lockdown, but should we have some sort of a situation, similar situation, what are the plans that the Treatment Action Campaign has in place to make sure that people receive their antiretrovirals, that somehow or the other you get it to them wherever they may be?
So for treatment action campaign, because we are not service providers, we are just advocacy group. What we do when we face this situation, like what we did last year, we make sure that all our field workers and our comrades and people who have to respond are always in place, make sure that they have airtime and data so that they can respond to calls. And also we call each and every clinic to check to say, is their treatment, is the clinic working, and how can we assist in our communities to make sure that people are going to take their ARVs. If the clinic is closed, how can we refer them to another facility? So that is what we've been doing, and we'll continue to do that as treatment action campaign.
Are you happy with the type of responses you're getting? Are you finding that people with HIV are beginning to become more compliant as far as their antiretrovirals are concerned?
Yes, we are happy because people now they're starting to understand HIV and they are adhering to their treatment and understand why they have to take their treatment. But still, there are challenges that we still have concern on, especially when you talk about population, your lesbian, gays, sex workers, drug users, which are not accessing services. At the end of the day, these people are human, and also they have rights. So we are so much concerned about them getting services, but also even the situation at facilities, the nature of our health facilities on the ground are not up to standard for people to access ARVs completely or correctly. Also, the youth that is not coming to take ARVs, we are really concerned because we have more young people who are infected with HIV, but we are not sure where are these young people in the system in terms of taking their treatment.
Your final message of hope to people listening into us this morning?
My final message is that living with HIV is not a death sentence. You need to just take your treatment, and I'll also encourage more people who are living with HIV, those who are on treatment and not on treatment, to make sure to say that those who are on treatment, they also get vaccinated for COVID-19, and those who are not on treatment, they must make sure that they go to facilities and access treatment, and we are here to support them and also get vaccinated so that we don't lose more of people living with HIV because of the two viruses that are affecting us as a country.
Very well said. Sibongile Tshabalala, TAC Chairperson, talking about World AIDS Day. Thank you indeed for your time. Go well and God bless.
Thank you. Thank you very much.
4:10 exactly, and that means it's wrap-up time for us. Thank you indeed for your company. Hope you've enjoyed the show as much as I've enjoyed your company. A big thank you to our two producers, Nazreen Naidu and Zian Milazi Boy. And of course, I'm going to continue reminding you of the COVID protocols. Mask up, sanitize, and social distance. Please, please, please keep safe, keep your loved ones safe. Go well and take care on the road.
Breaking stereotypes.